An improved way of detecting cervical cancer early could significantly reduce incidences of women dying from the disease in Uganda. With just a swab stick, women can conveniently do a self-examination and hand over the samples to clinicians for further tests. The campaigns are now being done in rural communities across the country to encourage more women to screen for cervical cancer.
Screening before used to be done with the use of pelvic exams and speculums, which is a lot of put off for so many women. But over the years, advances in science have come up with what they call a self-collecting test, where the women are given a swab like this. They are given instructions how to do it and collect a sample themselves. So this takes away the need for pelvic exam. And they do that barrier of fearing privacy and so on, the discomfort of the speculum, all that is done away with.
Cervical cancer is the most common among women in Uganda, and more women die from it than any other cancer. Doctors say the self-collection device could be a game changer in preventing the disease.
The barriers at individual level, one of them is the need for pelvic exam. Many women, if there's nothing hurting, nothing paining, will take a lot for them to feel like, let me go and dress, have this put in my reproductive part and have a screening. So it's a big barrier. However, with the self-collection, with a swab, it puts off that invasion of privacy.
The World Health Organization has set up targets for states to eliminate cervical cancer by 2030. There are almost 7,000 cases of cervical cancer reported in Uganda every year. Of those, more than half result in the death of the patient.
Within the three broad goals, one is having 90% of young girls who are eligible by the age of 15, having them vaccinated against HPV, against the HPV virus, which is really the causative organism in cervical cancer. We're also aiming to have at least 70% of women between 35 and 45 years screened with at least a high-quality test. But also we're ensuring that 90% of women who have cervical cancer get the necessary treatment.
Globally, cervical cancer is the fourth most common cancer, causing more than 600,000 deaths every year. Doctors say the self-test, which is being promoted as the likely preferred choice for women, is as reliable as samples collected by healthcare workers and could help countries end cervical cancer. Isabel Nakiria, CGTN Kampala, Uganda.